Let's square up South Florida and Florida. We're going to deliver breaking news. Holy Cross Health has been recognized by the HRC as one of the best in America for LGBTQ+. This is breaking news that came this morning from the American Hospital Association 2024 conference, Accelerating Health Equity. In an unprecedented achievement, Broward County's Holy Cross Health has earned the LGBTQ+ Healthcare Equality High Performer designation in the Human Rights Campaign Foundation's Healthcare Equality Index. This is the first time the faith-based hospital healthcare system has been recognized like this by the HRC for their achievements for the LGBTQ+ community. The 2024 Accelerating Healthcare Equity Conference is happening right now in Kansas City. This prestigious designation was awarded in the 16th edition of the Healthcare Equality Index. Here's how it works. Out of over 7,000 healthcare facilities in the United States, a record-breaking 1,065 of them actively participated in the Health Equity 2024 survey and scoring process. 462 of them, I was going to say just 462, but we're happy there's 462, received the LGBTQ+ Healthcare Equity High Performer designation. Even more significance on this morning's news is only approximately 15 faith-based hospitals and health systems received the recognition of outstanding healthcare delivery for the LGBTQ+ community. Holy Cross Health is one of them. Kim Saswick, Vice President of Community Health and Well-Being, stated, quote, "Health inequities and systemic differences in health status of different population groups, social determinants of health, such as poverty, unequal access to health care, lack of education, stigma, and racism, are underlying contributing factors of health inequities. Turning the tide of these inequities is not only possible, but also imperative. Holy Cross Health has recognized this, making health equity an explicit and implicit priority. Holy Cross Health is an agent of local change and is changing the narrative, taking action that will promote health equity. These issues are an important priority for healthcare professionals year-round." I loved this part, not just during Pride Month, end quote. Continuing its leadership, Holy Cross Health has also ranked in the top 25% of America's best in-state hospitals in 2024. Kelly Robinson, president of the Human Rights Campaign, also emphasized the importance of the inclusive healthcare services and fighting discrimination. Robinson said, quote, "LGBTQ+ people and their loved ones are looking for healthcare providers to offer and champion fully inclusive services. The Healthcare Equality Index is helping people find facilities where welcoming policies and practices are the standard. We know that LGBTQ people, especially our trans family, continue to face discrimination in the doctor's office. No one should have to put their health on the back burner for fear of mistreatment in a healthcare facility or by their doctor," end quote. Being a Catholic, not-for-profit community hospital makes today's announcement even more historic. Holy Cross sits in the shadow of one of America's largest and best LGBTQ+ communities. Holy Cross serves as a beacon for marginalized communities welcoming and meeting LGBTQ+ healthcare needs. To learn more about Holy Cross Hospital, all you have to do is visit holy-cross.com or connect at Holy Cross FL. Well, first off, wow, congratulations.
Yes.
Yeah.
I am sitting at Sunshine Cathedral at the studios here at Happening Out, and every single day have to explain to LGBT, wait, religion doesn't necessarily have to be a rejection. And almost every conversation I have about Holy Cross is, wait, give it a second look. And now the HRC says, oh yeah, we did. Congratulations.
Yes, thank you.
What did y'all think about this morning's news?
We were so excited. And wished we could be in Kansas.
Yeah.
But our shoes
Well, you had
work,
to be at Queerness tonight.
Right.
Yeah. We had to be here. We wouldn't have made the flight. But we're so excited. It was a lot of work put into the documentation of what we're actually doing, but well worth it.
Yeah.
And we're really thrilled because we know the community recognizes that designation and award status, and it's another way to say, come to Holy.
You know, it's interesting on that observation, because I want to certainly fold y'all in on your reactions to the award. But this is different. I just want to take a highlighter to what you just said. USA Today says, here are the good hospitals in America, and the American Medical Association says, here are the good hospitals in America. But the HRC is a whole different thing.
Right.
Because they're focusing specifically on the delivery for marginalized community, LGBT specifically, focusing on here are the checks that you really have to accomplish to vertically through the entire hospital or healthcare system say, wow, you're succeeding for your patients. And that's what the HRC recognition accomplishes. Other reactions? Both of you being members of our community, you just must have been thrilled.
Well, I mean, I'm incredibly proud, right? So here I am, the first openly gay board chair of Holy Cross. And in the same year, through the hard work that Kim and Vaughn put to getting, and a lot of other colleagues, we have this sort of good housekeeping seal of gay approval.
That's right.
And I think that that's so incredibly powerful. I know that our CEO, when he got the news this morning, our board members are just delighted. Of course, they knew we had applied, and you're always on pins and needles a lot. It's very comprehensive. It took months and meetings, right? Kim and Vaughn. I was involved on it kind of tangentially, but these guys put it together. And we know in our hearts what we do, but to have this outside accrediting body in a way tell us, hey, you guys are doing a great job as a high performer in LGBTQ healthcare. It just is the icing on the cake. And I think it also has created some interesting dialogue with our colleagues at Trinity Health, which is our parent company, which has over 90 hospitals, who now are looking at Holy Cross and saying, oh, well, we need to do this at our hospitals, right? So we're helping create not just local system change, but also nationally.
Let's take that highlighter and make sure that we zero in on this, because I don't think most of our listeners might necessarily understand what you just said. Holy Cross Hospital is owned by Trinity Health, which has 90 hospitals around the country. Trinity is a major healthcare supplier in the United States. What you're saying is because of Holy Cross's Trinity Health is faith-based for all 90 hospitals. All of them are faith-based. So because Holy Cross was able to accomplish this for LGBT, it says first and foremost that great healthcare and LGBT embracement do not have to be exclusionary.
Correct.
That's the first thing that this recognition from HRC says. And then second, what you're saying is you can use Holy Cross's example in terms of what Yvonne and a Kim and a Roy and others, hundreds and thousands likely, are doing, and say to the entire system of the other hospitals, you can do this too. That's what you're saying.
That's right. And in fact, Kim worked very closely, Kim and Vaughn, with our system office in Michigan. We're very lucky. One of our board members, Loranda Shestang, is also a board member of Holy Cross. There's always a Trinity representative on our board. And Loranda joined our board, and she is the Senior VP of Diversity, Equity, and Inclusion for all of Trinity. And she was down here in January. We took her to the Wilton Managed practice, to our other practices in town, to our Women's Center, to our cis-drunk practice that we have in the African-American community in cis-drunk. And I think she left here just so happy and impressed that the mission that she holds dear, right, which is diversity, equity, inclusion, is alive and well. And I think that inspired her, and she was very helpful, as was the system office, because there's things that we can do locally, but there were things in order to get this designation that we needed corporate approval for, right? And so in terms of policies and things like that. So it's really great, and I'm excited and hopeful that, I don't know, did any other Trinity hospitals apply? Do you know, Kim?
I believe there's one that was announced today. Yes.
I didn't remember that.
Yes, in New England.
In New England. Great. So now we have two, 88 to go. So,
Right.
but the point is that our leadership at the Trinity level, our CEO of Trinity, our senior executive team understands. You know, one of the core values of Trinity Health and Holy Cross is eliminating racism, and all the isms, as I call it, and also servicing marginalized communities, especially those experiencing poverty. And the Sisters of Mercy, who founded our hospital, are very much advocates of that. And we actually have 2 sisters who serve on our board, and they came down for our meeting just last week on April 29th. And it was just so nice to have them here. And we had mentioned that this was in the works. We didn't know the results. They were like super excited because like, this is what gospel action is. And that, and if you speak to Darrell, the pastor here at Sunshine Cathedral, I'm a member here, he'll say the same words. It's like, you know, what is the spirit? What does it mean to serve in that spirit of the gospel, right? And the spirit of the gospel is of love and inclusion, right? And that's the gospel I read. It's pretty obvious to me. And to hear the sisters, you know, present, they did a beautiful presentation at our board meeting about the pillars of the Sisters of Mercy. And it was all around social justice, helping the poor, very similar to your 11 pillars, actually, that you put forth earlier. So I'm really proud of that. And I think that this will just continue to also then give permission, if you will, to other Catholic health systems. There are many in this country. Trinity is only one of them, to also take a second look.
Can, from your words to God's ears, literally, can we get the Baptist to come along with us?
Well, yeah, actually, interestingly enough, when I was at ACHE, the American College of Health Executives has periodic networking meetings, and actually Baptist Health also is involved in this process locally down in Miami and up in Palm Beach. So yeah, I mean, I think a lot of this is being driven, Kim, correct me if I'm wrong, not only is it the right thing to do, but hospitals are being told by the Joint Commission, you need to get your act together on this. So I'm not surprised of this record number of applications, because ultimately, if you don't do this, you could jeopardize your Joint Commission accreditation, which, among other things, is the Good Housekeeping seal of approval, but also something called deemed status, which basically means if Joint Commission says you're okay, you can get Medicare funding.
Yeah.
If they don't, you won't.
Yeah, and this is not put on the pretty dress or put on the pretty suit.
Oh, no.
You have to walk the walk.
Oh, yeah.
This
very intense.
This is done every 2 years, and the detail of the implementation in a corporate structure for a healthcare hospital or a healthcare system is incredibly.
You know, when Kim first approached me with the project, I'm like, oh, okay, I'm a data person. I love working with data and information, right? I thought, okay, this won't be a problem. Oh my gosh. 2 5-inch binders of documentations that we had to submit. I mean, we were scrutinized under a microscope.
Yeah.
And it's awesome that we could say, yes, we've done this. We've done this.
That makes the sauce for the goose. This is really important.
Yes.
Yeah.
In getting this recognition.
And it's not something that you could go down a checklist today and accomplish.
Yeah.
You have to have a track record. There has to be a history. So it really emphasizes that if you're interested at all in this work and getting this type of recognition, you better start today, because you're not going to be able to apply until tomorrow.
Right.
And so it forces people. Yes, the Medicare and the JCO, it's tied to it, but that's not why we're doing it. We're not doing it for the bottom line. We're doing it because it's the right thing to do.
It's the right thing
for
to
people
do.
and to serve.
Yeah.
I agree. And I think we're doing it for that reason. I don't know if everyone might be doing it for that reason.
Yeah.
But the point is, it's being done. And I have to really hats off to HRC, right? Because for years they've had, I guess this is the 16th year now of this index.
Yeah.
And I have to really applaud Human Rights Campaign, because they have created this environment where we're awarding healthcare organizations for this kind of behavior, hopefully for the right reasons, like Kim mentioned. People have to come around for whatever way they get there, right?
Yeah.
As long as they get there. So
that's
I would love it that every single hospital in South Florida have the same designation.
Well, and that was going to be my follow-up here. So this recognition, just first, it's, and again, to emphasize, the name is Holy Cross, and being able to get this recognition from HRC, which is a representation that really you are walking the walk. What do you think the ramifications of this recognition will be? Broward County is a great county for LGBT. Miami-Dade County is a great county for LGBT. How do you think this is going to resonate on other healthcare systems and other hospitals around you?
Well, we certainly hope they'll catch on. Absolutely. And see us, at the forefront of this and say, they have been at this event and they have done this. And, if you talk to people in the community, you get very positive results and positive accolades for the hospital, the physicians, the practitioners. So it's my hope that they would embrace it and join us.
And from your seat as the board chair at Holy Cross, what is your thought to that observation? How will this resonate with peer healthcare hospitals and systems around you?
It's a good question. I think some of it will be a little bit of envy.
A little envy goes a long way for positive things.
And respect.
Yeah.
And again, one of the missions of Holy Cross is to be a transforming, healing presence in the spirit of the gospel. That is our mission statement. And I think from a board chair seat, this just continues to further the mission.
Yeah.
Right? And helps other organizations who maybe weren't sure. And hopefully it'll go beyond the walls of Broward County. It's a very progressive county. Hopefully, up in the other parts of the state that maybe aren't as progressive as we are, that they'll say, gee, a Catholic hospital in Fort Lauderdale just got high performer status from HRC. If it's okay for them, maybe we ought to be looking at that.
Yeah.
Like, it almost creates cultural permission, right, for other faith-based organizations to look at.
One of the examples that I have to bring up is how Holy Cross, from my seat and watching what you're doing, how you're integrating in community. At the end of the day, you walk the walk. You want to be a great healthcare provider. That's the number one thing, clearly. But to be able to do that, you can sit inside the walls of your castle, or you can cross the moat and come out into the community.
Absolutely.
And it's one of the things that I have noticed, and of course, led by the two of you. And Vaughn comes on anchoring at Queer News Tonight, and he'll do an event. And you recently did an event that was held in a chapel. And I don't remember the exact details. That's not really the importance of it. But he talked about the event, and so many of my friends said, "Wait, this is an equity and LGBT encouraged event in a chapel at Holy Cross."
Absolutely.
And wait, what's going on there? And it was an illustration of you're coming into the community saying, we want you to come in and we are going to be affirming and embracing, and we're coming to you.
Right.
It's examples of how you're really deciding this is how we're going to bring our message and our mission into the community.
Right. Yep.
Go ahead.
Oh, no, I was just going to say, for me, the importance is, especially since I work so much with HIV, is when we look back in history in the 80s, people today don't realize or understand, as I call it, the horror of HIV/AIDS. And I think it's important that we continue to tell those stories and who were on the front lines during that time. And I think that's a very important lesson to be learned when we talk about the church and we talk about, the people who were involved.
And that event, which was a celebration of an author who wrote a book called Hidden Mercies. And it talked about the involvement of Catholic, both laity and nuns and priests
in the AIDS crisis.
In the 80s, in the AIDS crisis. And I actually lived through that. I was a young nurse, very young nurse, in New York City at a Catholic hospital. And there were three basic hospitals that cared for these guys, and it was mostly guys at that time. Was Cabrini Medical Center, where I worked, St. Vincent's, and St. Clair's. And Mike, the author of the book, basically chronicles through first-person interviewing and through research. And he's a young guy. I was surprised when I met him. He's like in his late 30s, but he's a scholarly researcher. And it brought back a lot of memories. Some of them were kind of sad. So many friends that we all lost who come from that era. But it also was very powerful to hold this event in our chapel. Mary Carter Warren, who's our mission leader, she just did a fabulous job bringing this gentleman here with Kim's support and the leadership support to talk about that story, because they are hidden mercies. This is not anything new. We're at Holy Cross, we're just on the shoulder of those sisters and those priests back in the day who were there when no one else wanted to care for these guys, right? So,
Rudy, you do understand, however, you're telling a story that a very significant percentage of the LGBTQ community would go, huh?
Right.
I agree.
Understand that.
100%. And I mean, I get it. When I was asked to serve on the board, I had phone calls from friends. They were like, are you sure you want to do this? I'm like, what do you mean? They're like, well, it's a Catholic hospital. I'm like, yeah, I get that. I said, if anybody knows that I don't do anything unless I can speak my mind. And so I didn't have any fear. And in fact, I will say, when I first joined the board, I wasn't sure. I'm the only one, the first one. But the response from my fellow board members has been incredible. People that I would have never thought would be an ally all of a sudden share that, oh, my brother is gay, or I built my business here with a lot of LGBTQ support and I'm very supportive of the community, or my sister is trans. I mean, it's just so interesting to listen. But you're right. I mean, there's a little bit of a shock value, right? But I just keep telling people the same thing. It's your own implicit biases, right? You think, oh, it's Catholic, or it's not going to work for me. And I get that, not to minimize that. There's trauma involved, right? Those of us who grew up in the faith, not always had the most positive, and still to this day, there's still some mixed messaging happening. But we just are easily for us to say, because we can challenge and we can sort of write our own narrative at Holy, that at our place, you're good. You come in, doesn't matter what your faith tradition is or not, doesn't matter who you love or not, doesn't matter who you pray to or not. And we're trying really hard to work in relationship with our communities, not only the LGBTQ community, but the Jewish community. We have a
Black community,
the African American community. We are the only healthcare provider, thanks to Kim and her team's efforts, in the Cis-Trunk neighborhood of Fort Lauderdale. In the site of the old segregated hospital. Holy Cross DNA is of inclusion. When the hospital was open, our first CEO, who was a Sister Innocent, in the 60s, overnight integrated our hospital. Remember, in the 60s, hospitals were segregated. And she didn't have to go to a committee. She didn't have to go to the board. She didn't have to go to the governor. She's a nun. She answers to a higher authority. And guess what? Overnight, Holy Cross became the first hospital in Broward County to employ African-American physicians that was not an African-American hospital, right? So we continue in that fight. And there's other communities. We talk about the Muslim community. We talk about other communities that share our neighborhood, right? That everyone needs to feel welcome. And that's just, for me, why I joined this board. My why is specifically for the LGBT community, to help create that bridge of understanding, not only from the hospital's perspective, from the community's perspective. And what Kim said about being there every day, not just on Pride, that's super important, because last Pride we were there, as were a lot of other healthcare systems, but day in and day out, who's at the bars, who's in Wilton Manors, who's going to the parades, who's doing Pride Fete, who's doing all these different events that impact all aspects of the LGBTQ community. It's Holy Cross, and I'm so proud of that.
Yeah, and to listeners on the news, on this breaking news of what's happened in Kansas City this morning, this wasn't last week. Oh, let's try to do this. This has been a 2-year journey for you, for
the application.
Right.
But the work
is years,
more than
decades.
Exactly. So it's great news, and with a little wink and a nod, how will it feel to be the gay embracing hospital in South Florida? Boy, who would have ever thought that?
Well, I think we kind of always have been. It's just it's exciting to because what this does, it communicates to people who maybe are on the fence, who maybe don't know if they can feel safe coming to Holy. It's just another way from an outside organization, not us tooting our own horn, right? It's a very well-respected HRC, right, national organization, saying, you know what, it's okay. When you go to Holy Cross, you're going to be treated with dignity. And that's what it's all about, dignity, number one.
Well, congratulations.
Thank you.
This is really big news. I don't think to our listener, and perhaps to you too, I'm not sure that it has digested how big of news this is, especially because it's Holy Cross Health. So congratulations.
Thank you, Al.
Thank you.
And thank you for having us.